Welcome to the cardiovascular system. In today's lecture, we're going to go over the structure of the heart. We're going to look into things like how does blood flow through the heart? What are some of the vessels that make it up, like your veins, your capillaries, your arteries? What is actually within blood itself? So hopefully by the end of this session, you'll be able to describe the structures of the heart and their functions, list the order of blood flow, explain the stages of progression in atherosclerosis, describe the immediate blood pressure response to exercise, also be able to describe the effects of different forms of exercise training on blood pressure over time, identify blood pressure classifications, and also describe the cardiovascular benefits and adaptations when it comes to forms of exercise. So a couple of things that I want to teach you first is some rules that you need to remember. If you can memorize these rules, you should be able to answer any question that gets thrown at you in your multiple choice theory exam. And looking at these rules, one of the first ones is that veins in, arteries away. So if you literally look at the word vein, it has the word in within the actual spelling. So what that means is veins will always bring blood into the heart, whereas an artery will always take blood away from the heart. Second rule is, if you think in terms of the alphabet, A will always come before V, which means that blood has to enter an atrium before it goes into a ventricle. So the atrium will always be the entry point. If anything starts with an A, it is an artery. So if you look at the diagram there, you'll see the aorta at the very top. That is an artery, so it has to be taking blood away from the heart if you're looking at those two rules together. Anything that begins with a V is a vein. So something like the vena cava on the left-hand side there, you've got the superior vena cava, the inferior vena cava. Because they both begin with V, it is a vein. Anything else will actually be labelled as what it is. So you'll notice if you look over on the right-hand side, that kind of blue arrow leaving the heart, it states that it is an artery. It's the pulmonary artery. The two red arrows coming in will state that it is the pulmonary vein. Other thing to remember, your last final rule is if it has the word pulmonary in it, pulmonary refers to the lungs. So let's look back at those other two again quickly. And in fact, let's bring up a better picture here for you. Let's look at the pulmonary artery on that top right hand side. So we know it's an artery, and arteries go away from the heart. So if also the word pulmonary means lungs, we know that this is a vessel going away from the heart to the lungs. So it's taking blood from the heart to the lungs. If it's going to the lungs, that would suggest that it's deoxygenated blood, because it has to go to the lungs to pick up fresh oxygen and get rid of the carbon dioxide. If you look just below that now, you've got the pulmonary vein. So again, we know veins come into the heart, and the word pulmonary means lungs. So it's going into the heart from the lungs. So that would now suggest that this has come from the lungs and is now full fresh with oxygen. So looking at that, it's going to be filled fresh with oxygen. If we think of the other rule, so A before V, it's then going to go into the atrium before the ventricle, where it's going to go up and leave out of that aorta. And the aorta starting with the letter A, we know that's an artery. Because that artery is going away from the heart, the aorta, and we know that it's now fresh with oxygen, that would also suggest that that is going to be distributed around the body so that the muscles can get the oxygen they need to produce energy. One thing I would also suggest doing is maybe taking a screenshot of this or drawing this out, memorizing this, because this is the full circulation of blood. So let's start at the top from the lungs. So we have just picked up fresh oxygen. So pulmonary veins are going to send the blood into the heart, where it's going to go into your left atrium, down into the left ventricle, where it's going to leave via the aorta. So that example we spoke about a second ago. That's going to distribute all of that blood with the oxygen around the body, at which point the body's going to use that oxygen for energy production. Once that oxygen has been depleted, it's now converted into carbon dioxide, so the body needs to get rid of it. So it's going to come back up into the heart via that vena cava. So V, we know it's a vein, into the right atrium, because A always comes before V, which means it goes into the right ventricle, where it will send it out via the pulmonary artery. So it's going back to the lungs now to get rid of that carbon dioxide and pick up fresh oxygen. Then what we've got is we have some valves within the heart. And a little bit later on in this slide, I am going to show some diagrams of these and their locations. For the time being, we just need to note that there's 3 different types of valves in the heart. And like I say, I'll show these on a diagram a little bit later on. But we have the atrioventricular valves. So it's the valves that separate the atrium and the ventricles. You have a semilunar valve, which, as it states there, is a pulmonary valve on the right and the aortic valve on the left. And then you have a cyonatrial valve, which is a bit like I suppose your natural pacemaker. It's what makes the heart contract. And again, when we pull some images up later, I'll be able to go into a little bit more detail with those. So just keep in mind their names for now. So some of the vessels. So we've kind of looked at the heart, and we know we've got arteries and we've got veins. But we have arteries and veins all over the body. And the job of an artery is to carry oxygenated blood from the heart to supply it to the vital organs and the muscles, the tissues all around the body. Because it deals with a lot of pressure, in the sense that when the heart contracts, the artery is what is going to receive that blood first, they have to have thick muscular walls to prevent them from rupturing. So, which means it's going to deal with any kind of blood that is under high pressure. So what you'll notice from that diagram is it has a thick outer wall, a narrow central tube, and then a thick inner layer of muscle and elastic fibers. The reason it has elastic fibers is to allow for that flexibility through the pipe. Then we've got your veins. Veins always carry blood to the heart, so therefore they are carrying deoxygenated blood. And because they're bringing blood from, say, the lower body back up to the heart, they don't need to withstand as much pressure. Therefore, they can afford to have a thinner outer layer and a thinner inner layer because they're dealing with less pressure. So they don't have to worry about massive volumes of blood being pumped out. Their job is to just bring that blood back up the body. So they can afford to be a lot thinner, and they don't need to be able to withstand that much pressure. Then you've got your capillaries. Capillaries' job is to distribute the oxygen into the tissue. So think of your vessels now as a bit of a roadmap to some extent. So imagine your arteries are like your main motorway. What comes off of a motorway is normally going to be an A road. So it's still quite a popular, busy road, but it's not like your little residential roads yet. So your arteries are like your motorways. Then your veins come off of that, and they're more like your A roads. And then your capillaries are like your residential roads. So they're the ones going to the actual location. So a capillary is what takes the oxygen to the location. So these capillaries might be surrounding, I'm going to give you an example here of the quadriceps. Let's say you're training quads. Blood's going to come out through the arteries down into the veins, where it's going to meet these capillaries, which are going to surround that quadricep. What happens here is it acts a little bit like a tea bag, in the sense that if you've just got a tea bag with tea in, you just kind of got it in your hand, that tea cannot leave that tea bag. The moment you put it into boiling water, the tea will start to distribute out through the walls of the tea bag itself. It's exactly the same as how a capillary works. The oxygen will diffuse through little pores in the capillaries into the muscle tissue, but likewise the opposite process happens, and the carbon dioxide diffuses from the quads back into the capillaries, where we then eventually will distribute it and get rid of it out of the body. So, what makes up blood? First thing we've got is red blood cells. So, red blood cells, their job is to transport oxygen around the body. So, they're like your little kind of taxis or Ubers. So, your oxygen kind of jumps in, the red blood cell will distribute it around the body. Your white blood cells is like your defense. So, it's like having a little army inside you that fight off any infection, bacteria, to try and keep you healthy. You then have what we call a platelet. So a platelet is just fragments of dead blood cells, but instead of just getting rid of them, the body will utilize them. So it acts as like a clotting agent. So imagine you kind of cut your hand a little bit, and normally if your hand bleeds a little bit, it forms a scab over the top. The reason it has formed that scab is because your body has sent platelets to that area, to clot that wound and allow it to actually scab over to prevent you from constantly bleeding. And then the final thing that we find within our blood is plasma. So plasma is a straw-coloured liquid, and it's 91.5% water. The other 8.5% are other solutes like your platelets, your white blood cells, red blood cells, your salts, your things like that, all your electrolytes. But the reason it's 91.5% water is because it's what makes blood fluid. Without plasma, it would be like trying to push Marmite or tar around the body. So the plasma gives it fluidity. A couple of things I just want you to note just from this slide here is we need to know that from an anatomical point of view, we break circulation down and put it into two different categories. We have pulmonary circulation and systemic circulation. So we know the term pulmonary means lungs. If you look at the word systemic, it sounds like system. So all we're doing is saying that pulmonary circulation is the blood flow between the heart and the lungs. Systemic circulation is the blood flow between the heart and the body's systems. So we just split it into two different categories. So if it were to come around to an exam, they were to ask you a multiple choice question, they might give you an example of saying, the right ventricle, does that fall under pulmonary or systemic circulation? At which point, if you've memorized the blood flow of heart, you would know that that falls under your pulmonary circulation. And again, here's just another kind of slide here. It's worth just taking a little snapshot if you want to, or maybe just writing this down just to memorize it. But this is just a written version of that flow chart that we showed you earlier. Okay, venous return. What is venous return? The term venous return just refers to blood returning to the heart via veins. So the blood circulates around the body. Let's just say blood has reached your foot and it now needs to get all the way back up to your heart so it can be sent to the lungs to get fresh oxygen. We would refer to that as venous return. The other thing I want you to note on here is a term called blood pooling. So blood pooling happens during exercise, and it's when the blood is sent to a particular area that you may be working. So let's say you're training legs. You're doing a really hard session, you're giving it everything that you've got. All that blood is circulating around your body and it is being sent to the legs. If you decide to, let's say, not cool down, so you may have experienced this in the past, you've trained legs, you've gone to stand up and all of a sudden you feel really lightheaded. Or you might have done a spin class, got off the bike, again, felt the same thing, felt lightheaded, dizzy, nauseous. What's actually happening is because all the blood has been sent to your legs, you have a lack of blood sitting in the upper body. So there's not as much blood circulating up to the brain. So you go to stand up, you're not getting the oxygen delivery that you need, so you start to feel a bit nauseous, which is why it's extremely important when you're training your clients, you make sure to give them a little bit of time to cool down. Even say they're on the leg press, just give them maybe 20-30 seconds just to kind of sit, relax, take some deep breaths, allow the blood an opportunity to travel back around the body, because the moment you're training legs, all the blood is being sent there. So you need to give the client time to allow for that circulation to go back around the body, so when they stand up, they don't start to feel dizzy, nauseous, because in extreme examples, it can cause them to faint. Okay, the cardiac cycle. So the cardiac cycle refers to the heart itself contracting. So your heart will contract in two phases. You've got the actual contraction where the heart squeezes, and then you have a relaxation stage. So we put this into two different categories, and you may have noticed this. If you've ever had your blood pressure taken, you're going to have a higher reading and then another reading below. And on an average individual, it should be something like 120 over 80. So systolic or systole is the contraction phase. So that is when the heart squeezes. So because there's a lot of pressure going through the heart at that point, that will always be the higher number when you have your blood pressure taken. Then you've got diastole, which is the relaxation phase. So as the heart starts to open back up and relax, what happens is it creates a suction effect that draws blood back into the heart. Then the heart will contract again and squeeze, pushes all of that blood out, gives you that higher reading. Then again, it will relax, create a suction effect, draw blood back into the heart. So you just need to know that the contraction phase is called systole. The relaxation stage is called diastole. Then we've got heart rate. So this is important to know because let's say you've got your first client, you've sat down with them, you've done their medical questionnaire, you've taken their blood pressure. What you should also get on a blood pressure monitor, it will give you their resting heart rate. And whenever you are taking blood pressure, always make sure you take it 3 times and get an average reading, because odds are clients can be nervous to start with. The first reading's never going to be fully accurate. So a healthy adult should have a resting heart rate of anywhere between 60 to 80 beats per minute. Anybody who is a well-conditioned individual, so we're talking like athletes, should be around 35 to 50 beats per minute. And then just looking at that kind of bottom quote there, it says the heart is a muscle, and just as skeletal muscle gets stronger when exercised, so does the heart. So as the heart gets stronger with exercise, it can push more blood out with each contraction. So it's why a healthy individual will have a slightly lower resting heart rate, because it doesn't need to beat as fast to get blood around the body. And then I've got 2 more terms for you just to make a note of here. Something called stroke volume and something called cardiac output. So stroke volume refers to the amount of blood that leaves the heart every heartbeat. Cardiac output refers to the amount of blood that leaves the heart per minute. So it's just worth noting, stroke volume is per beat, cardiac output is per minute. Okay, blood pressure. So obviously we spoke a little bit about blood pressure just then. What the actual measurement is the amount of pressure that is being applied to the walls of the artery. So that kind of 120/80 reading you get, the high number is the amount of pressure that has been applied to the artery as blood has left the heart. It's produced by the contraction of the heart, and as we kind of looked at in the previous slide, we're referring to the systolic pressure, which gives us that high reading. The diastolic pressure gives us the lower reading when the heart is starting to relax. And for the average individual, we should have an optimal blood pressure of 120/80. But what I want to show you here is some classifications. And I just want to state that you need to make sure that when you take on a new client, you get their blood pressure readings. And you can go and purchase an electronic blood pressure monitor off somewhere like Amazon for maybe £15. It's worth getting, because let's say if you was to take on a client, and this is not to scare you, but say you didn't take their blood pressure, didn't realize that actually they were basically struggling with high blood pressure, say the client might not have even been aware, you start to do exercise with them and it causes them to maybe have a heart attack, and it ends up they're now in hospital, you could potentially be liable for that because you didn't take the steps to ensure that the client had a healthy blood pressure before exercise. So always make sure when they first sign up with you, take their blood pressure. And in an ideal world, if you look at the table at the top right, we want our clients to be sitting in that normal kind of category, so that 120/80. You've then also got something called pre-hypertension, which again you can see in that table in the top right. So pre-hypertension basically just means the client's on the verge of getting high blood pressure, but they're not quite there yet. So it's slightly elevated levels, but you're still fully able to train this client because you can reverse this through exercise. However, it's important to note now, if your client falls under stage 1, stage 2, or stage 3 hypertension, you will need a doctor's note to be able to train them. So if they've got stage 1 hypertension, so anything from like 140 to 159 over 90 to 99, what this would suggest is that they've just developed high blood pressure. So you need to send them away to a GP with a letter saying, look, I need permission to be able to train this client and advice on what I can do. They would go to their GP, they would probably come back to you with a letter. Odds are at stage 1, the doctor would say, yep, you're absolutely fine to train them as long as it's like low intensity, low impact, because it's going to help lower their blood pressure. That may also be the case with stage 2. If anybody is of stage 3 hypertension, it has to be an immediate medical referral. So what I mean by that is you have to suggest to them right there that they need to go to the hospital, because stage 3 would suggest they're on the verge of having a heart attack or a stroke. So there's no two ways about it. You have to tell them, like, look, you need to go and seek medical attention right now, because they could potentially be on the verge of dying at this point, and any form of exercise that elevates that could cause them to die in the gym. So always make sure, if they're stage 3, it's an immediate medical referral. Stage 1 and 2 is doctor's note. Okay, so looking at some circulatory diseases here, we have something called atherosclerosis. And then underneath you've got arteriosclerosis. So to go over these, atherosclerosis, as it says there, is a progressive narrowing of arteries caused by a buildup of plaque inside the arteries. So this is pretty much down to bad lifestyle. So they're constantly eating high fatty foods, they're not exercising, plaque is building up. So you can see on that image, the plaque has built up. We're still pushing out the same amount of blood per beat, but now it's got to try and get through a smaller space rather than a wide opening, which is now going to increase the amount of blood pressure, which can potentially put them at risk of heart attacks. If you look at the bottom one, arteriosclerosis, this is now a progressive degeneration of the arteries that will lead to hardening and loss of elasticity. So the actual arteries start to become harder and there's less flexibility in them. So it's important to know the difference between the two. And then just at the bottom, you've got varicose veins. So varicose veins is when the little doorways, should we say, so the little valves inside a vein don't close properly because there's a bulge in the vein. And the purpose of those doorways is because they're bringing blood up to the heart against gravity. The doorways are to stop the blood from falling back down again. So blood will pass through one door, it will close behind. It goes up through another door, closes behind. So the blood will always reach the heart. With a varicose vein, however, blood can trickle back down again, which is why you often see somebody with varicose veins, you often see it in the lower body. You'll see that the vein is really red or even with a purple colour on the leg and it stands out. And that's purely because there's a lot of blood sitting in that area and it's harder for the body to bring it back up again. And just to give you a little more of a representation, like from an image of atherosclerosis, you've got inflammation on the top one. You can see a narrowing on the second one there, and then a complete blockage at the bottom. So if that plaque ruptures into the actual artery itself, causes a blockage, that's when things like a heart attack or a stroke can occur, because we cannot get the blood around the body, get that oxygen to the brain. Couple more slides now. So some of the long-term effects of exercise on the circulatory system. So basically, how does exercise benefit us? So what you'll notice on the left there is it says that the left ventricle increases in volume and its muscular wall becomes stronger. So basically, we're now able to push more blood out of the heart. If we can push more blood out per beat, that means more oxygen, more nutrients. It's going to be better for the body. Stroke volume is going to increase. Arteries and veins are going to be better at delivering oxygen and removing carbon dioxide. You're also going to have increased capillarization. So do you remember me saying that you've got like your motorways are your arteries, your veins are your A roads, and then your capillaries are like your residential roads? What starts to happen is eventually there will be a traffic jam. So I'm going to give an example here. Let's just say you've only got 10 capillaries on your quads. We can only deliver so much oxygen to those 10 locations. So as you start to get fitter, what happens is the body goes, do you know what? Let's build some more residential roads. So it builds another 10. So now that traffic jam is reduced. So you can now train for a little bit longer before you kind of gas out. All of a sudden you start to get fitter again. Do you know what? We'll build another 10 rows, then we'll build another 10 and another 10. And now you've got 100 surrounding the quad. So you can get so much more oxygen to it. You can train for longer because your body is getting fitter and it is adapting to it. So yeah, as we train, your body will start to develop more capillaries. And then blood volume will increase. You're going to have a reduction in blood pressure to bring it down to a healthy level or even like an optimal level. And you're going to also have increased fat metabolism and improved cholesterol profile. So your cholesterol levels will start to look healthier. And then I mentioned right at the beginning, I was going to show you some images of the valves. So you can see here, you've got your pulmonary valves, a tricuspid valve, mitral valve, and an aortic valve. And you'll notice they go into two categories, your semilunar and your atrioventricular. So anything that falls under atrioventricular are the valves that separate the atriums and the ventricles. So again, might just be worth a little snapshot, or if you want to draw this out, just to try and remember the names of those valves. And then one other thing that I briefly mentioned at the beginning as well was a cyonatrial node. If you look on the left-hand side, the second one down, you'll see that cyonatrial node. So it's our body's natural pacemaker. It is that causes the heart to contract. So imagine it as like a little electrical taser. If you was to take a taser to somebody, their muscles are going to stiffen up as they fall down. It's exactly the same with the heart. So what's going to happen is that cyonatrial node will send an electrical signal through the heart, causing it to contract. So the heart will now squeeze, causing blood to leave the heart. Then it stops sending that signal, which is then where the relaxation stage comes in. The heart can then relax again. Then what it's going to do is it's going to tase it again, cause it to contract, then relax. And it's just that constant process that causes the heart to contract to get blood out, followed by that relaxation stage. And that is your circulatory system.